Hello again, everyone. Today on Take Two, I am talking to Dr. Alexandra Greenhill. Alex is an innovator, not just in technology, but also in medicine and healthcare. And I'm really excited to hear about her latest entrepreneurial project. Alex is the CEO and Chief Medical Officer of Care Team Technologies. And Alex, the first thing I want to ask you is, with Care Team Technologies and with your career in general, what's the problem you are trying to fix?
Well, the problem we're trying to fix is that healthcare is still not the kind of healthcare we all want for our loved ones. And as we're inventing new treatments and methods and approaches, they're not connected well into the system. And so the fragmentation of healthcare is getting worse, not better.
And so how do you address that then? How does your technology address that fragmentation?
Well, we've looked at what's missing in healthcare that all of the other domains have. And in fact, we don't have good project management. If you call every disease a project, there is no clear plan of action for each person that's personalized to their needs. There's no clarity as to who is involved on the healthcare side, but also on the patient side, and in what role, and what can they do to help. And how do all of these different devices, apps, and treatments all come together in the right sequence, in the right timeline, in order to deliver the best outcomes and also the best experience.
So give me for instance, like a little mini case study. What are the effects of all this fragmentation on your average, say your average patient, to pick someone?
Yeah, I mean, we've done work in dementia. And so you get diagnosed with that, you're given a fairly significant life-changing diagnosis. And then you get sent home with maybe a pamphlet or a lot of verbal instructions, and people are trying to remember, what did they say? Just as you're trying to process the significance of this change onto your life. And dementia is the kind of condition where family members have to get involved, your spouse, your elderly adult children, but keeping everyone on the same page can be very complicated. And so the right things will eventually happen, but will be delayed. Somebody will have a burnout experience as a caregiver, and all of that is preventable if you put everyone on the same page and give them a clear plan of action. Another domain might be cancer. When one of the projects we're involved with BC Cancer and Providence Health here in Vancouver is the average time of getting diagnosed with skin cancer is 36 weeks. Because it takes a series of appointments, follow-ups, biopsies, results in order to have this. And everything's doable within a week if you coordinate it carefully. The problem is melanoma stages change in 36 weeks. You can go from stage 1 to stage 3 in that time, and stage 3 is obviously much harder to treat. And so why can't we do it all in a week? We're doing the exact same things, they're funded, but they're just not coordinated because what's missing is a project management function around ensuring that the right things happen at the right time.
So how does it work then? How does your platform work?
We work with a healthcare organization that has developed a best method of how to do things, and they can easily put it and digitize it on our platform and then distribute it to all of their clinicians. And the clinicians can adapt that to whatever their individual patients need. And so if some patients need an accelerated or they need more time to implement things, they're given a personalized to-do list between appointments, and the clinical team can see is that to-do list getting done or not, and intervene and support the family better to ensure that the right things happen as expected.
And so from the patient end, they have some sort of a way of interacting with this, obviously, as do the other members of the family and the care team. Is that?
Yeah, they get a digital plan of action. And we're not calling it a care plan, we're calling it an action plan because patients like that word better than care. And, when your life collapses with a big diagnosis, scary things like type 1 diabetes in children, cancer, dementia, all these big and complicated conditions, you get an up-to-date plan of what should I do next. And you can take that plan and share it with the loved ones in your life and give them full access or partial access to that information and say, okay, family, we now need to ensure that all of these things happen in this sequence, who's doing what. And the medical team can be the backup and say, hey, it's been 2 weeks. We gave you instructions on what to do to support grandma in her home, but you're not doing this. How can we help? What else is needed?
So would this be, I'm just thinking about the home care, that whole area of work. Would that facilitate or ease the need for home care a little bit? Would it support them better?
It would, because for every patient, the dream is to stay at home. The dream is to stay out of hospital. And so this makes it possible to organize a little bit of what you're hearing, like hospital at home, which is instead of having to go in for a series of procedures, do them from home, but they're carefully coordinated and they happen as quickly as they would if the person was in a hospital. And in terms of aging or dementia at home, there's so many services that exist to support patients, but people just don't know who they are. And so we're working with the Ottawa General Acute Geriatric Department, who's in a partnership with 39 community partners, supports patients at home using Care Team, and knows exactly which organizations involved. If they send a referral out to, let's say, home meal delivery or visiting nurse, they know, has this referral been accepted? Has the appointment happened? Is the family using it? And so you get this clarity over what's actually happening in a distributed healthcare system. And because everyone calls our system a system, but it's not one system, it's a collection of organizations trying to help.
So again, I'm thinking about the aging population. Do the clients then have to have a bit of computer literacy to be able to?
Great question. Yeah. One of the biggest things that we need to dispel is that ageism, is the assumption that people who are older don't understand how computers work. Luckily, if you design software well, they're more than well versed in how to use technology. They usually get the hand-me-downs of their adult children. So they have the recent generation iPads and iPhones and laptops. And it's easy for them to learn how to use something that was designed for humans to use. And so if they know how to use Facebook or a Zoom to do a Zoom call, they can use Care Team. We did plan for people who don't have that capacity. And typically it has less to do with age. It has more to do with education or employment history or a barrier like language. And so we do have different language versions of the software, but for some people, they will never use the computer or digital. And so we have a print button. You can actually print the plan of action and give it to someone who will deposit it into the client's home, leave it on the fridge for everybody else to see. But the medical and social services around the person can be on the same page. Their adult children or siblings or loved ones can also intervene. And there's a scenario where the last mile may be a human. So a neighbor goes over and checks on somebody who lives alone and reports back on the interaction through the software. So volunteers can be activated and respect the COVID bubble, for example, is dedicated to that family so that we ensure the safety for everyone, including the volunteer.
So if people are interested in this, how would they be able to make use of it? They would have to talk to their practitioner, who would have to have some bigger agreement with Care Team, right? Or how does that?
I mean, it's still early days. And so we are working through health organizations first. There are ideas about how and what we can do to make it possible for people who are interested to activate this for their loved ones in the absence of a healthcare organization. But that just implies so much more work to figure out what are the right actions. It's not in the cards yet, but we are looking for people interested in giving us feedback. We have a patient panel and we have a clinician panel for people who are saying the current status is not good enough. We'd love to co-create the future. And so we're always looking for people willing to give us feedback. We love listening to stories where things didn't go well, so we can learn from that and imagine if people had the software in hand, what would be better? How can we solve that and prevent that type of experience from happening to anyone else? And part of dealing with some of the trauma that this has created for some families is sharing the story so that they can make a difference in someone else's life. So we've heard some horrific stories, but they've already been implemented in the software as a solution to prevent that exact scenario from happening to anyone else.
Right, right. And can you give me just a quick capture of your professional career? Because everything has sort of been leading up to you reimagining the whole delivery of healthcare. So in a in a nutshell, where did you come from to start doing this?
Yeah, thank you, Johan. I mean, a lot of it came in our conversations around, when you helped me get the TED Talk sort of thinking going. I didn't realize the extent to which all of my life experiences have prepared me for this. And so I was a patient for the first 12 years of my life. I had multiple surgeries to repair something that happened when I was 11 months old. And so I got to see the system on the good side, on the bedside. My mom was told many times that your child's not going to survive the night, or we have to amputate her arm. And she persisted, the doctors persisted, and I still have both arms well functioning. And so, taking that miracle of modern science, I became a physician and was an occupational therapist working with the aging population, then an emergency room doctor, and then got very involved in implementing new ideas in healthcare, the Institute of Healthcare Improvement. So quality improvement type of initiatives, and also technology, from computerizing hospitals to paper charts in doctors' offices to telehealth, the first direct-to-patient telehealth, Medio, and now then Dialogue, which are two of the companies that still exist in that space. And it was a sort of a quest or idea that I've seen progress in my lifetime in healthcare, but the progress happens too slowly and it takes too long, and technology can accelerate that. And so Care Team was fundamentally created to take good ideas that are implemented in the old school way with phone and paper and allow them to be digitized so you can distribute them to more people faster and have a better impact, and allow all of these clinicians who are getting burnt out right now trying to do things in an innovative way in an old system to take their creative ideas and provide the kind of care that they went into school dreaming to provide for their patients.
Which is not an insignificant side benefit. That I hadn't even thought of it that way, but that's brilliant. Wonderful. Thank you.
We have comments from some of our doctors that they love practicing again, because patients come in and the history is clear as to what has happened. And then they can say your instructions are on Care Team and not get the phone calls the next day saying, what was it that you said? We're not quite sure, or come back at the next visit and people like, I misunderstood and that didn't get done. And so, bringing people joy to practice again, it was not expected, but has been a delight.
That's great. Well, thank you, Alex, so much for talking to me, and thank you for what you do. I'm always in awe of your energy and your entrepreneurial spirit. So keep it up. I think you're doing fabulous things.
Thank you, Joanne. It's a pleasure to see you again.
You too. Bye for now.